Today, we are going to be talking about cognitive behavior therapy for depression treatment.
Cognitive behavior therapy, also known as CBT, is a type of therapy that develops techniques to challenge and overcome the intrusive negative thoughts, feelings, and behavior that one is experiencing. It helps one develop techniques in order to challenge and overcome intrusive negative thoughts through hands on practical approaches to problem solving. Before we go further into CBT, we are going to talk about some of the causes and the symptoms of depression. There are both biological and psychosocial changes that can cause depression. With biological problems, there is normally an imbalance of neurotransmitters such as dopamine and norepinephrine, as well as low levels of serotonin. Depression can also be a predisposition of genetic factors and/or changes in the brain cells. This is typically treated with medications, while psychosocial problems are primarily treated with CBT. This leads us into our next topic, the psychosocial causes of depression. This consists of a negative event occurring that is significant to a person, such as a death in the family, and then their internal belief system interprets the death as somehow being their fault. It is the internal belief of the event and why it occurred, rather than the event itself, that causes one to be depressed. Now let's move on and discuss the symptoms of depression. How do we know when someone is experiencing depression? Are there age-related differences in the symptoms? Common symptoms can include the following: insomnia, troubled breathing, loss of appetite, expressionless, and dysmorphia, which is feeling sad or feeling down. In addition, if anyone is experiencing these kinds of symptoms for more than 2 weeks, there is a good chance they may be depressed. However, it is difficult to diagnose this in an older adult as it could be due to normal age-related changes. Therefore, it must be evaluated very carefully. In most cases, depression affects females, but it can affect a person of any sex, race, or age. Although signs of depression in older and younger adults can be different, younger adults report feeling depressed, while older adults typically report feeling a sense of helplessness. Younger adults indicate an underlying psychological problem, while older adults feel less emotional expression. Older adults also report feeling more physically tired, and all these symptoms in older adults may simply reflect normal age related changes. Benefits of CBT and how it works. When you use CBT, you are teaching your brain a new way of learning and seeing things in the world. CBT is a way of training our brains to be more rational. During CBT, a therapist will help you identify your negative or false thoughts and replace those with thoughts that are healthier and more realistic. For example, you may feel worthless or obsessed with your flaws. CBT can make you aware of these thoughts, then teach you to swap them out for more positive ones. These changes in your attitude can lead to a change in your behavior as well. Dr. Cause, I lost my wife about a month ago in a car accident, and I'm having terrible thoughts about how it was probably all my fault.
Well, why do you think it was your fault, Terry? Tell me what happened before the accident.
She was having a bad day, and I just wanted to get her out of the house. So I decided we could go for a drive to the market, maybe get her some flowers to brighten up her day. As we were about to turn onto Main Street, I must have not looked both ways, but someone was coming in the opposite direction, and the next thing I remember is waking up to the paramedics taking my wife into the ambulance. This is all my fault because I was the driver.
Now, Terry, just because you were the driver does not mean it was your fault she died. You had no control in what the other driver was doing in that situation. There was no way to stop the car from hitting you.
It's so difficult to not think like that, though. I have a hard time trying to sleep since her death. I'm consistently thinking about what I could have done differently that day for her.
It's normal to have these feelings, Terry. One way that can help with your sleep is trying some meditation up to a half hour before bed. This will help calm your thoughts and help reduce your anxieties. Hopefully, this will help you get some more rest.
In conclusion, CBT can help when controlling your way of thinking in a more rational way. When you have control of your thoughts, your internal belief system can change, and then eventually you can build your own confidence. Therefore, as our thoughts and beliefs change in a positive way, we begin to act more rationally. our expectations become more in line with reality and common sense. Therefore, what we expect to happen thus happens.